early on in our Kamwingi days, we had a mother that came in with two kids, an older sibling and a younger sibling, and the younger one was extremely unwell to the point where she unfortunately died within maybe an hour or so of arriving at the clinic. And I remember the older sibling just racked with grief, and she ran out into the car park of the facility and threw herself face down and was just wailing. And I mean, it's impossible to know how to deal with that scenario. And I think all of our staff, myself included, went away and had a little cry after that. But I mean, I guess they're the kind of things that you think, what could we have done to maybe change that scenario for that person? And I think in many other occasions we were able to, to just get there a little bit earlier and make that difference. And if you contrast that with an Australian system where the death of a child is a fairly unique scenario, whereas in our work, in peak malaria season, we might have 1 or 2 children die a week.
Now that I have children, I know what it's like to have a sick child. And I know how lacking in control you feel and how scared you feel that someone's life is in your hands, and your own heart and pain and joy and all of that is wrapped up in that other person being well. And I think there's so many women all over the world, but so many more in Africa and in Uganda that don't have even a glimmer of control and don't have access to even the simplest of treatments and health care for their children. And that's just not okay. And so I think the thing that I want to see happen in Uganda with Maranatha Health, with other organisations, whoever, I want to see more women actually have an option, actually have a choice to go, yes, I'm going to take my child to this place. And someone's going to look after them, and someone's going to give them the right medication, and someone's going to talk to me and explain it, and someone's going to care for my child, and they're going to be okay.
The child came from a very long way away, and the child was unwell and visited multiple clinics, ending up at the government referral hospital in Fort Portal. Very, very sick, and she had a blood test and was told that the mother was told that she needed a blood transfusion, but they didn't have any blood to offer her. And the night that they spent at the hospital, the child continued to deteriorate, started having seizures, and the mother was obviously extremely worried that things were getting close to the end. So someone in the ward actually told her, look, there's a clinic for children called Maranatha Health, the other side of Fort Portal. I think they often have blood. I think you should take your child there. That might be her only hope. And so this child arrived, we gave the child a blood transfusion, we treated the malaria, we stopped the seizures, and I think within 2 or 3 days she was fine to go home. As this child was preparing to leave, another child and a mother came in, and the child was in a very similar scenario, very unwell. And the mother was extremely anxious, as you would be. And the mother of the child, who had been unwell but had now improved, turned to this mother and said, don't worry, you're at Maranatha Health now. My child was exactly like yours, and look at her now, you'll be fine. And I think, that kind of stuff it makes what you're doing worthwhile.
I think that's what I want. I want women to be able to make that choice and have that choice available to them. To go, yep, I can go to the healthcare centre down the road and those guys will look after my kid, because at the moment it's just not like that. Maranatha is a community of people coming together to try and make really long-term, grassroots, intentional change in people's lives in rural Uganda. I think it's a community of people that believe that people deserve access to good quality healthcare.
And we hope that from there, that will develop into something bigger, that it can be something that perhaps fans across Uganda and into Africa.
I would love Maranatha to have a global impact. I would love us to remind people in the West of our responsibility and our ability to respond because of the resources that we have.
The power of Maranatha Health is in its people. I think we're going to see people who have been involved with this organisation doing all kinds of stuff, and that's going to be the really exciting multiplier to see what comes of that.
And so I think Maranatha is about hope. It's about showing people that there's more.